All right, so let's go ahead and take a look at the pelvis and thigh lecture today. And again, we'll be following along with the Trail Guide to the Human Body by Andrew Beal. So if you wanted to crack out your book and follow along with us, by all means do so. So again, whenever we look at a kinesiology chapter, we want to start with looking at the bones, and then we want to put those bones together to form joints, and then look at the movements of those joints. And then lastly, we're going to look at the muscles. Now, I will say that this, in my opinion, is one of the easiest lectures to learn, especially in regards to movement and muscles, because we only have one major joint that we'll be looking at, which is our hip joint, our femoral acetabular joint. And we have muscle groups that pretty much is responsible for performing the various movements that we'll see at that joint. So let's go ahead and just crack into these bones, and you'll see as we move along how it's a pretty relatively simple complex here. So let's take a look at a pelvis here. Now, when it comes to the pelvis, there are three major regions that make up the pelvis. We have this upper region right here, known as the ilium. We have this region right here on the back that we would sit on, often referred to as our butt bones, right, which is our ischium. And then right here in the front is our pubis, our pubic bones here. So we will look at a few various landmarks to each of these. Namely, the ilium is going to have the most landmarks that we'll see, and then a couple extra landmarks regarding the other regions. So the first landmark we're going to look at on the ilium is this upper ridge that we feel right here. Now, if you actually put your hand on your hip, you would feel this ridge, and you can, work. It's kind of like an arcing motion around your hip. So it's like, put your hand on your hip and question what someone's saying. So we call this ridge here the iliac crest. So the iliac crest is a very easy landmark to find on our clients and palpate. Also serves as an attachment site for lots of muscles that we'll see later. Then another important landmark is, if we were, and very easy to find on our clients, if we palpate along the iliac crest all the way till we get to this bump right here on the front of the pelvis here, on the front of the ischium, or excuse me, ilium, then we'll find what's called the anterior superior iliac spine. So let's just take a brief breakdown of that name, anterior superior. With those two words, that's implying the existence of several things. One, there's a posterior version. Two, there's an inferior version, right? Because anterior, the opposite would be posterior, superior, the opposite is inferior. So, and then iliac spine just refers to the type of landmark on the actual ilium itself. And we'll see, several muscles attaching to this landmark, and how cool it kind of is in regards to seeing and differentiating like postural distortions. So right below that, you'll find another bump right here, which is the anterior inferior iliac spine. So we acronym the anterior superior, the ASIS. And then we acronym the inferior version, AIIS. And so, as we said, it implies the existence that there's a posterior version. If we follow this ridge all the way to the back, we're going to find another bump. And we have the posterior superior iliac spine. Again, acronym PSIS. And then right below that, the posterior inferior iliac spine, PIIS. So we have the iliac spines. We have anterior and posterior versions, superior and inferior versions of each of those. And so our another landmark here is we'll actually look inside the pelvic bowl itself, which is this broad surface here. We call this the iliac fossa. Remember, as we said before, a fossa is a shallow depression, right? And so we can see that the convexity of this particular bone, it would be a nice little making of a fossa or shallow depression. So then, on the outside is the gluteal surface. Now, there's different ridges and stuff here, but I'm just going to conveniently call everything here the gluteal surface because we'll see that our gluteal muscles will attach to this region as well as others, depending on which muscle we're looking at. For the pubis, we really only one landmark we'll take a look at, which is going to be the pubic crest, which is the upper ridge right here. And then on the ischium, there's only one major landmark we want to pay attention to, which is a bump on the very bottom of the ilium itself, or ischium itself, which is what we literally call our sits bone. It's called the ischial tuberosity. The ischial tuberosity is a little bump on the bottom of your butt that you sit on. So some other additional bones in the pelvic complex here we'll take a look at. Right, we've already kind of looked at the sacrum and the coccyx in the previous lecture, but we'll just kind of recap that real quick, just because it is relatively important for this lecture, which is, our sacrum, remember, is 5 individual vertebrae that have been fused over the course of our life and become a hard bony plate. Our coccyx is pretty much the same thing, but made out of 3 or 4 different bones, depending on, however you were born. So that's pretty much it for the pelvis right there. Now let's take a look at a femur. So the femur, we're going to need to bring this guy down a little bit here. So a femur here, first, well, actually, we're not done with the pelvis itself. So here, all of the, maybe I'll just use the picture on the book here to kind of get a better idea. So all of the I don't know why my camera shut off. All of the different parts of the pelvis meet here. As you can see, this red line indicates the separation of the different regions, the ischium, the pubis, and the ilium. So this socket right here, where all of these parts of the bones meet, is called the acetabulum, which is going to, as we'll see here, make part of the actual joint known as the hip joint. So now we need to take a look at the actual femur. So the femur itself is relatively simple, and I'll probably just stick with using this image here. So first, if we're looking at this image, we're looking at a posterior femur. And then we should find an anterior femur. Nope. So a posterior femur, posterior femur is fine, because we'll see a little bit more landmarks here in regards to that. So one, in this image, you can see that there is a large rounded structure that is sitting inside that acetabulum that we had just observed. And we call this the head of the femur. So the head of the femur is then attached to the bulk of the femur with what we call the neck. So there's a neck right there. And then we have the greater trochanter. So this is actually a very important landmark and a very easy to find landmark on your clients. We're going to see lots of muscles attaching to the greater trochanter. It's that big bump that you feel on the lateral side of the hip. Now so greater trochanter implies the existence of a lesser trochanter. The lesser trochanter is actually on the medial side of the femur in this case, and it's pretty deep and pointing into the body. So it's actually very and extremely difficult to palpate, as opposed to the counter opposite greater trochanter. So then we'll see that on the back of the femur, there are lots of lines. One notable line is the linea aspera. And we'll see, just because muscles attached there. But I like to say the linea aspera. It's the line on the back of the leg close to the assets that we have in that region or area. So the linea aspera is right there. So at the very distal end of the femur, we have condyles. Very similarly resembles the humerus that we'll look at as well in another lecture. And so that's pretty much it for our femur. We do have the tibia, which we'll take a look at in another lecture. So we won't worry about it too much for now, but we'll definitely need to pay attention to that later on. So those are our bones. Now let's go ahead and take a look at the actual joints. So as we said, one of the major joints was the femoral acetabular joint, which is your hip joint. And so the hip joint can perform these various actions, which includes flexion, extension, adduction, abduction, internal rotation, external rotation, and then, of course, because of the nature of all of its movements, it can perform circumduction, which is that circular movement, as we've seen before. And we can do the various types of add and abduction, such as horizontal and transverse add and abduction, because of the dynamic movements that a ball and socket type joint can perform. So with that said, the femoral acetabular joint, your hip joint, is just that. It's a ball and socket type joint. And so let's take a look at the actual actions it can perform. So if I point this camera down, we can take a look at our little buddy here. So at our hip, if we're looking at the side here, we can find that, so flexion is when the hip lifts up this way. So lifting your hip straight up, or if you were sitting in a chair, as you might be sitting in a chair right now watching or listening to this video, then your hips are in a flexed position. Then extension is the opposite, where we're going to take the leg and bring it backwards, like we're rearing our leg back to kick a ball. Abduction is to take the leg out to the side. Adduction is to bring it towards the center and across the body. So we have horizontal adduction and abduction, which is to just go side to side, abducting in the horizontal plane, right, which is in a horizontal line. And then we can do internal rotation, which is where our foot would turn in. So if I did internal rotation, my foot would turn in or towards the body. This is internal rotation of the hip. External rotation is if my foot points out. So that my hip would actually be rotating inside the actual socket in and out. So internal and external rotation, also known as medial and lateral rotation, or inward and outward rotation as well. We can use all of those various terms. And then circumduction is to just make a circular movement with the leg itself, which is technically just a combination of various amounts of movements, which includes, at minimum, flexion, extension, adduction, and abduction. Now, of course, if we add in the rotation as well, then we have a very complete form of circumduction, in my opinion. Now, another joint that we'll be taking a look at is the tibiofemoral joint. The tibiofemoral joint is, well, your knee. So because it is composed of the tibia, which is the bone in your lower leg, and your femur. As we can see, the condyles of the femur itself are articulating with the tibia. In this particular case, the condyles of the tibia. So condyles to condyles, right? And so our knee, well, pretty much just flexes and extends. So flexion of the knee is when our knee is bent and our heel comes towards our hips. And then extension of the knee is when we kick our leg out straight. Now, because it can only perform flexion and extension, it is what we call a hinge joint. But our knee is actually a special type of hinge joint, which we call a modified. Okay, I don't know why you're giving me so much trouble with your hip, but we call it a modified hinge joint because it actually performs small amounts of rotational movement as it moves in and out of flexion and extension.
They text your phone? I didn't know that.
So in this particular case, our knee, I'm just going to pick this guy off and take his leg off. So our knee, as we bend our knee, as we flex our knee, our knee actually kind of rotates in one direction, and as we move into extension, it rotates back into position. So it's almost like a little screwing action, because we call this the screw home mechanism, which just allots for the little bits of internal and external rotation at the knee as it tracks and travels through its range of motion. So now there is one more joint we'll take a look at, which is more of a complex. I call it the pelvic complex. So our pelvis can move, right? And we did take a look at this in the previous lecture that we recorded, but if our hips tilt forward, we call that anterior tilting. So if my hips roll forward and my butt sticks out, I call that the booty pop position. We have what's called anterior tilting of the pelvis. Now, if I tuck my hips backwards, we have what's called posterior tilting. So anterior tilt is where my hips will point forward, my butt sticks out. Posterior tilt is where my hips point forward, or my hips roll back, and my pelvis points forward. Now, there also is lateral tilting of the pelvis, which is where one side of the pelvis goes up and the other side goes down. And that's basically what happens when you walk, right? One side of the hips lift up and the other side lowers down into that figure 8 pattern that we recognize for gait pattern. So we also have another major joint, well, technically have one on each side that we'll look at, but no real movements to this joint, which is the sacroiliac joint, which is where the sacrum and the ilium meet. Now, there is minor movements, but they're negligible for what we need to learn. And, when you're really into like the orthopedics and, all that kind of stuff, then you'd probably learn more. But for now, we'll just keep it simple. And just knowing the sacroiliac joint is where the sacrum and the ilium meet. Now, as I said, we'll give a brief demonstration of the muscles here, where I mentioned that the muscles are pretty much grouped up for the particular actions that we find at those joints, right? Namely, and especially the hip joint, the femoral acetabular joint. For flexion of the hip, it is predominantly produced by the Iliopsoas group that we'll take a look at later. And then, of course, we also have other additional muscles such as the rectus femoris. We have the Sartorius, and minor others that will help and assist, like the TFL. For extension of the hip, our primary extensors of the hip are our hamstring muscle group and our gluteus maximus, our big butt muscle. For adduction, well, we literally have an entire group of muscles called adductors, which also includes other names that don't have other muscles that don't have adductor in the name, such as gracilis, pectineus. But we'll also take a look at those muscle groups. And then abduction is another movement produced by the glutes, right? Our glutes and other various muscles are going to abduct our thigh out. And then, of course, like we said, internal and external rotation. We'll find various types of rotations performed by adductors and so on and so forth. But one of the notable external rotators that we want to take a look at is the piriformis. And if you've ever gotten a massage before or recognized massage to any minor degree, you've probably heard of piriformis and massage therapists talking bad about piriformis, but I'll tell my 2 cents about piriformis and how I think those people are just a little bit crazy. So now let's go ahead and actually get into the bulk of all those muscles. Now, like I said, all of our muscles in this particular case come in groups. And luckily, these groups only have so few actions and only just a couple little fun facts to really learn about them. So let's take a look at our first muscle group, the quads. So our quads, as the name implies, quad, four, riceps, seps meaning head. So this means a four-headed muscle group that is responsible for moving or on the femur, right? So four-headed muscle group on the femur is literally what quadriceps femoris group means. So what are the muscles that are in this group? Well, we have, and I did write this on the board, and I'll probably fill in the rest. We have rectus femoris, probably the most notable that we'll put the most fun facts into, rectus femoris. And then we have three muscles that have the same first name, and they're all hanging out together. We have the vastus muscles out of the group. We have vastus medialis, which means it's on the medial side, vastus intermedius, which is in the middle, and then vastus lateralis, which is on the outside or outer edge of the thigh. So one, what's our first fun fact? Well, one is that all of these muscles are responsible for extending the knee. As we saw here, but I failed to mention, when we look at the tibiofemoral joint, we had flexion and extension, right? Our quads are responsible for the extension of that knee. They extend the knee out. Then the hamstrings and gastrocnemius are responsible for flexion. We'll take a look at that in a moment. But all of these muscles will extend the knee. However, here's the first major fun fact, is that only rectus femoris can actually perform flexion of the hip. Why? Because if we actually look at where these muscles are, we'll see that rectus femoris is the only one of the group that actually crosses the hip. So as we see here, we have vastus lateralis, right, only attaching onto the femur. You can see right here in a better view, right, only on the femur, vastus medialis only on the femur, and then vastus intermedius only on the femur as well. So they can't possibly flex the hip because of their attachment sites. So rectus femoris is the only muscle out of that group to be able to flex the hip. And it's pretty much, it is a powerful hip flexor. And another fun fact is that it is a bipennate muscle, which means that it has the, distinct leaf-like or feather-like appearance, as we have the muscle fiber stemming from a central tendon on both sides. So all of these muscles will form into what's called the common quadriceps tendon, which then passes over the knee and then inserts past the knee onto the tibia, tibial tuberosity, so on and so forth. But for now, we can just keep it simple and say that they form the common quadriceps tendon and attach to the tibia, and then go from there. Then with the vastus muscles, since they only attach to the femur, well, we'll just say they attach to the femur and literally only just say that, well, intermedius is, in the middle, lateralis on the lateral side, medialis on the medial side. Simple enough. But rectus femoris attaches to that cool little landmark that we learned, the AIIS, the anterior inferior iliac spine. So again, we see that it crosses the hip. So I like to say that the quadriceps group are the can-can muscles, right? If you ever know that dance, the can-can, the little burlesque thing, right? So where we just flex the hip first, rectus femoris. Flex the hip and extend the knee. We have all power of the quads, including the vastus muscles and the rectus femoris in this particular case. So our next muscle group is the hamstrings. And, well, let's take a look at what muscles we have in the hamstring group. One, we have biceps femoris. So another bicep muscle, not like the biceps brachii, because if we look at biceps, they both have biceps in the name, but femoris means it's on the leg. Biceps brachii means it's on the arm. but both of them mean two-headed muscle. So that means that the biceps femoris has two individual heads. We have a short head and a long head. And then we have the semitendinosus and semimembranosus muscles. So what are these muscles responsible for? Well, they're responsible for, as we saw here in this list, for extension of the hip and flexion of the knee. So what are our very simple actions, right? So one, let's take a look at some of their attachment sites. They all come from the ischial tuberosity, which is that big bump on the bottom of the butt, the ischium and the ischial tuberosity especially. Now, the biceps femoris will come down to the lateral side, and these are the semi-muscles. Here's the biceps femoris. So the biceps, here's our long head, and then here's our short head. So the biceps femoris attaches to the lateral side of the knee. So we're just going to say lateral side of the knee to make things simple and easy. And then as we can see here, our semitendinosus and membranosus muscles attach to the medial side of the knee. And this is how I like to remember things. So one, biceps femoris doesn't have an M in the name. So that means it's not on the medial side. So we have semimembranosus, semitendinosus, semimembranosus. Now, one common thing that you might get quizzed on is what is the order of these muscle groups? From medial to lateral or lateral to medial. If you write it out like this, then you have that order. So biceps femoris is the most lateral, semimembranosus is the most medial. And again, I use the name to kind of remember that. Semimembranosus has more M's in the name itself and thus is more medial. It has M and M and M, 3 M's in there. So more medial. So that means that from medial to lateral, we have semimembranosus, semitendinosus, and then on the most lateral side, biceps femoris. So hamstring muscle groups, again, pretty simple. They will extend the hip and flex the knee. So now we have our gluteal muscles up, which our gluteal muscles, again, are in a group. So there's 3 muscles in this particular group. We have gluteus maximus, and in this particular case, we're referring to size. Gluteus maximus is the largest muscle. Gluteus medius and gluteus minimus, which obviously would be the smallest. So gluteus maximus is the muscle that we iconically recognize as the butt muscle, as the butt. And with a picture, we can kind of see where it's attaching to. The gluteus maximus, obviously being the largest of them all, attaches on lots of different attachment sites, right? So we have part of the iliac crest, we have the sacrum, we have the coccyx, right? And then it reaches out and will touch the linea aspera of the femur, as well as it inserts on 2 parts of the iliotibial tract, or what we call the iliotibial band, which you might recognize as the IT band on the lateral side of the thigh, which we'll find a picture of later on here in the book. So the gluteus maximus is probably the most interesting of them all. And lo and behold, the gluteus maximus, because it's so large and spans so broadly, actually does antagonistic actions to itself, because some margins and some fiber directions of the gluteus maximus will abduct the hip. However, some of the lower margins here will bring the thigh back towards our body for adduction. But again, it's an external rotator or a lateral rotator of the hip, as well as it extends the hip. And so if you've ever been into the gym before, you've probably seen yourself doing some exercises for the gluteus maximus, which is those donkey kicks, which you kick back. Well, if you actually go full range of motion, first your leg starts going out for abduction and then swings back in for adduction as you get the total contraction of the glute muscle itself in this particular case. So again, fun fact, gluteus maximus is a antagonistic muscle to its own self, just again, and we only really find that with large muscles such as the traps, the pec major, right, gluteus maximus in this particular case. So gluteus medius and gluteus minimus, as you can see in this particular, oh no, it's just both, it's just the one. Gluteus medius is right here on that gluteal surface, gluteal crest, which, as we can see, does a lot, right? It's quite an interesting muscle. One, it majorly is responsible for stabilization of the actual hip and supporting of the actual hip is probably one of its most important key functions. But as we can see, we do abduct the thigh, but the nature of the fiber directions, because it is a bit of a broad muscle, right? We can flex the hip, we can extend the hip, and we can perform medial and lateral rotation. So it is a major and antagonistic muscle to its own self because of lots of its actions. So really, really interesting muscle here, gluteus medius, and probably one of my favorite muscles of the body when because I do personal training. One of my favorite muscles is the gluteus medius, especially I like to build the stabilization behind it for clients. And so, and the reason it does all those movements is because that's what it's trying to stabilize. It's trying to balance and prevent instead of performing those movements, it's more of like anti-movements of those and performing in its performance. And so we can actually stabilize our gluteus medius with instability exercise, balance exercises, especially under weight and load. Really cool muscle. Love that muscle. And then gluteus medius, or excuse me, minimus, is actually deeper underneath gluteus medius and will abduct, as we saw for the common action of all of the gluteal muscles, is abduction of the thigh, as we like to say, as primary abductors, medial rotation, and flexion of the hip. Should also be important to note too that the greater trochanter is a big landmark for a lot of our gluteal muscles, right? As we can see in this particular picture. So medius and minimus, will attach to the greater trochanter, and then maximus, kind of attaches to the greater trochanter, but it actually goes into the IT band, and then, like we said, the actual femoral shaft here, the linea aspera. Now, looking at our next group, we have the adductor group, which, again, as the name implies, they are adductors of the thigh, of the hip. So they're going to bring the hip in for its movements. Now, there is 3 muscles that have adductor in the name. However, we're going to look at a couple accessory muscles that like to hang out and be part of the group as well. So our first adductors of the actual adductor group with adductor in the name includes adductor longus, adductor magnus, and adductor brevis. So as we can see, here's all of our adductors listed right here, which includes pectineus and gracilis, but we have 3 muscles with adductor in the name: magnus, longus, and brevis, and they all come from the pubic bone. So this is where we commonly have, adductor strain, people who strain their adductors, or people who play sports and, their adductors get tight. That's why they feel a lot of groin pain, right? That leads to the condition that we see called groin pain, and so on and so forth. So as we said, primary function for all of these muscles is to adduct the hip, bring the hip in. And then, of course, we will also perform medial rotation. With gracilis is a little interesting, right? It does a little bit of a flexion there because of the nature of its attachment sites, which we'll be focusing a little bit more on gracilis itself as well. But notice too, another fun fact is that adductor magnus, again, we have a very large muscle, can also performs extension here based off of its nature. Adductor magnus is actually a little bit further back, as you can see in this particular picture. It's further back in this picture than the others, and actually attaches more towards the posterior side of the hip, so it can perform extension. But, you know, all these movements aside, you know, adductor group is pretty much just for adduction. You know, we don't want to bog ourselves down too much with too much detail. But let's take a look at that gracilis in a little bit more detail. So the gracilis, again, comes from the pubic bone here, and then comes all the way down and attaches onto the tibia, which actually forms part of what we call the pes anserine insertion. Pes anserine means duck foot in Latin here. And so there's three muscles that form the pes anserine insertion, which includes the semitendinosus muscle, which we already looked at, the gracilis, which we just saw, and then one other muscle that we'll be finding later on, which is the sartorius. And there should be a picture that will come up for the pes anserine insertion. Another muscle here in this book is the TFL, as its acronym, the tensor fascia latae, as I like to call it. Think of it as the coffee of the body, the TFL. And, okay, perfect, our iliotibial tract here, iliotibial band. So the tensor fascia latae is a tiny muscle here on the, you know, somewhat anterior-lateral side of the hip, which right there from pretty much the iliac crest all the way towards and then pretty much inserting onto the IT band, right? This is a muscle that is responsible for rotation, medial rotation in this particular case, abduction, and flexion of the hip. So, and then here's a nice primary image of our IT band that is running from the pretty much the greater trochanter to the lateral side of the hip, all the way down just past the knee, which again just kind of supports these joints that it passes by. So TFL, tensor fascia latae, pretty cool muscle. Sartorius. Now here's our guy right here. He's a really fun muscle. So some people like to call him the Taylor muscle, or I like to refer to it as the gentleman's muscle, because if you actually look at this particular image here, I can't show it on camera because I'm standing, but you see that this individual has their leg crossed. And if you actually if you put your ankle over your knee, that pretty much performs all of the actions of Sartorius. Sartorius performs a wide variety of actions, including flexing the hip, externally rotating the hip or laterally rotating the hip, adducting the hip, flexing the knee, and medially rotating that flexed knee. And you know, technically, it actually can perform a little bit of adduction too, depending on the way that the muscle contracts in this particular manner. But it comes from the anterior superior iliac spine, the AIIS, and then inserts again into that pes anserine tendon or insertion. And here's actually a good image of that pes anserine insertion here, where we have the tendons of these three various muscles attaching to the medial side of the knee. So Sartorius is a really cool muscle. Like I said, we call him the Taylor muscle, or I like to call him the gentleman muscle, gentleman with his leg crossed. I heard someone say it's the Biggie Smalls muscle, Sartorius. Yeah, it's kind of funny. So another muscle group here is what we call piriformis, and we say the deep six, as we would often call them. So we can see what's called the lateral rotators of the hip, which includes, you know, piriformis, quadratus femoris. And then we have a few additional muscles, including obturator internans and externans, and then the gemellus superior and inferior. So commonly we call these the rotators of the muscle, so or the pelvic floor muscles, or the deep six, as we often refer to them, as they're ganged up together, and pretty much they're all responsible for various rotational movements of the hip itself. But piriformis again is the main one we really want to pay attention to. So piriformis comes from the sacrum right here, and then attaches to the posterior side of the greater trochanter here. So as we can see, it's really responsible for lateral rotation of the hip and abduction of the hip itself, especially when the hip, as we see, is flexed. Now, we should also understand too that if we look at that direction, right, if we actually flex our hip, it's going to stretch out piriformis. And to me, that's kind of important, right? Because a lot of people give piriformis a bad rep. Here's my particular 2 cents here. So one, it's important to note that right beneath piriformis is the sciatic nerve, branches of the sciatic nerve. And so, yes, it's quite possible and often enough common that the piriformis can irritate the sciatic nerve and create what we call piriformis syndrome. But why is the piriformis doing that in some cases? And so to me, like, there's a lot of massage therapists who just like to beat the crap out of piriformis and just dig into those glutes and hit the piriformis and all this stuff, right? But who is the person on the table with that piriformis problem that this massage therapist is working on? 9 times out of 10, in my experience, it's the office worker. And when we're sitting in an office chair, our hips are flexed, and typically, unless our knees are crossed, they're kind of internally rotated, which stretches out, lengthens out the piriformis, and then it keeps piriformis in a lengthened position for so long that, of course, it's going to stretch out and put compression on and put pressure on the sciatic nerve. So yeah, of course, the piriformis is going to cause the sciatic nerve to compress, and then in this case, because the piriformis is so stretched out, it's weak, right? So you working that weakened muscle that doesn't have the contractility to it is bad, in my opinion. And what I find better is that we actually strengthen piriformis and the lateral and external rotators and adductors, abductors of the thigh better, right? Instead of just mashing the crap out of piriformis. Also, the same thing about IT band. A lot of therapists out there really like to smash and crush and destroy the IT band when there's for really no reason at all. Some cases, you might want to get a little handsy with the IT band, but for the most part, light touch and moderate work on the IT band is going to be good enough. Same thing for piriformis. Honestly, piriformis, again, just getting a bad rap. Let me actually go ahead and just pop this picture up. That's kind of a nice little picture of the relationship of the piriformis and the deep six with the sciatic nerve. So we can actually see that little sciatic notches of the pelvis, which are landmarks we didn't quite take a look at, but it passes right through and right underneath the piriformis and actually the gemellus superior, and so they can actually get pinched. It can actually get pinched in there. But yeah, like I said, piriformis just gets a bad rep, in my opinion, for nothing. And yeah. All right, so another big major group here is the Iliopsoas group, one of our most powerful hip flexors of the body. So our Iliopsoas group consists of 3 various muscles, which includes, as the name implies, iliacus. Let me zoom out. Ilio refers to iliacus. Psoas refers to the psoas muscles. So in this particular case, we have psoas major, and we also have psoas minor as well, and iliacus. Now, I guess fun fact is that psoas minor, not everyone might have a psoas minor, so, whatever. But psoas major attaches to the anterior bodies of the vertebrae that we looked at in a previous lecture, and then attaches to the lesser trochanter right here. Iliacus comes from the iliac fossa and again to the lesser trochanter as well. So pretty much, aside from the rotational movements that they perform at the hip, their main responsibilities are to flex the hip as well as anteriorly tilt the pelvis. So, I think it's posterior tilt. Yes. Or no, it's anterior tilt. I was right. I'm crazy. So, confusing myself. Anyways, so what I want to say about the Iliopsoas group is that if you're a massage therapist and you think you can actually physically palpate and touch the Iliopsoas group, think again. I think it's insane to think that. First off, to get to the lesser trochanter, the insertion point of these muscles, you have to press through so many of the adductor muscles, and it's ridiculous. And you'd actually have to press through compromising structures such as, veins and lymph nodes and nerves. Then to even palpate toward, the Iliopsoas group is literally on. Maybe I could justify that you might be able to get some kind of margin on iliacus, but you will never ever touch psoas major because it literally attaches to the spine and runs right alongside the spine. You cannot physically get there as with physical touch. You have to press through the abdominal wall. You have to press through all the abdominal muscles, the fat curtain, the greater omentum. You have to press through the small intestines and large intestines. You have to press through the peritoneal wall just to get back to this area. There's too much structure for you to physically get there. So, in my opinion, the best way as a massage therapist to work the psoas muscle group is to stretch it and do muscle energy techniques, our post-isometric relaxation techniques, and PNF stretching and all that stuff. So Iliopsoas group are hip flexors, right? They are obviously responsible for flexing the hip. So an extra structure that we should take a look at and pay attention to, I think is kind of neat, is what we call the femoral triangle, also known as the inguinal triangle, because the inguinal region is, or as I like to call it, the ingroinal region is, in the groin. So it is bordered by the inguinal ligament, which is a ligament that spans from the ASIS to the pubic crest, Sartorius, and then Adductor longus. So within this inguinal triangle, which again, you'd have to actually press through this to get to the lesser trochanter to even, work the attachment sites of the psoas group. We also find the femoral artery, vein, and nerve, as well as inguinal ligaments. And then one thing that's not necessarily given, because, right, femoral artery, vein, and nerve, right, all with femoral in the name should be kind of given that it's there in the femoral triangle. But the great saphenous vein is also there as well. So the great saphenous vein is the medial vein that, pretty much drains a vast majority of the leg itself, and then dumps it into the femoral nerve, femoral vein, and then towards the inferior vena cava. So I think that might be all for this lecture. Again, like I said, very easy one to go over. That was it. And really quick. Real quick rundown, right? Like we said, we have two major joints, right? With movements, right? Femoroacetabular, the hip, flexion, extension, adduction, abduction, internal rotation, external rotation. Our flexion is performed by the psoas muscle group, rectus femoris, and the other various muscles that we saw, such as the, gluteus medius, the TFL, tensor fasciae latae. Extension is performed by the hamstrings and glutes, and as we saw, adductor magnus. Adduction performed by, the adductors, gracilis, right, and other muscles. Abduction, right, performed by the glutes. Internal rotation performed by various muscles, including the adductors. External rotation, as we saw, piriformis, right, and like we said, piriformis gets that bad rep. Compress on the sciatic nerve for piriformis syndrome. all that good stuff. Tibiofemoral flexion is performed by hamstrings and the gastrocnemius, which is your bigger calf muscle in the lower leg. We didn't really touch on that. Extension is performed by the quads. Remember our quadriceps group, 4 muscles, and rectus femoris is the only one that crosses the hip. All of them cross the knee, and they perform extension of the knee, and then only reflex rectus femoris performs flexion of the hip. Hamstrings, biceps femoris, semitendinosus, semimembranosus. The semi-muscles are on the medial side with semimembranosus, with the more M's being the most medial, biceps femoris being the lateral. Coming from the ischial tuberosity to the sides of the knee, we perform the extension and flexion of the extension of the hip, flexion of the knee. Our gluteal muscles, remember, our gluteus maximus and medius are the 2 really interesting ones that perform, antagonistic muscles, but pretty much they will abduct and extend the thigh, especially maximus. So those are some of the big takeaways there for this particular lecture. So hopefully, again, my suggestion is to just write out the groups of the muscles and insert those fun facts into your notes. So, well, I think that's going to be all for this one. We'll see you on the next lecture.